Hi, everyone, and welcome to the Quincy Democratic City Committee's De-Stress at Your Desk Stress Management Lunch and Learn. Thank you so much for joining us. I want to welcome Tracy Mullare and Dr. Greg Harris. They are both joining us today to discuss stress management and ways to deal with the stressful times that we've been dealing with today. I think I'd also like to thank Tanya Chamakian for helping us get this format together today. This conversation of creating this event came out of actually us having an events committee the day after the riots at the Capitol in January, and discussing really like how can we take kind of the stress that we're feeling and the kind of the vent session that we had, and how can we make this into something positive, something informative, something educational for our members to be able to then take and use in their lives. So I really want to thank Dr. Mullare and Dr. Harris for joining us today, and thank you so much, and please take it away.
Well, thank you. Thanks for having us. I think that we'll have probably a relatively short presentation and then hopefully ample time for questions, because I think that there isn't one answer for stress management. So I think, it's one of these topics that I think that there's a lot to sort of unpack. So I'm going to talk a little bit about the environment, particularly since COVID, just to help set the frame a little bit. And then Dr. Mullare is going to talk a little bit about stress management, and then we'll open it up. We'll show some resources and open it up for questions. So do we have the slides that we can start with? Oh my goodness, there they are. If we can advance to the next slide. So I just wanted to start with some of the things that we've been observing. I'm a psychiatrist, I'm a medical director at Blue Cross, and I'm in practice. I have an outpatient psychiatry practice. And what we've seen over the last year with the pandemic is a lot of issues. We've seen a huge uptick in anxiety. So generalized anxiety is just anxiety of all sorts. We've seen people that have existing psychiatric vulnerabilities have an uptick in symptoms. We've seen a worsening in substance use disorders, which is of concern, and of domestic violence, and worries that these things aren't being reported and people aren't getting treatment for both of those problems. They're at home, sheltering at home with worsening problems and fewer outlets. We've seen concerns of people managing non-COVID related care. There was a freeze a year ago in really anything that was not COVID related care for most care. That's opened up a little bit more, but people have deferred a lot of care. And then grief has been a huge problem, and complicated grief really, because the normal grieving process has been disrupted because of the pandemic. Again, things have improved over time, but there's been a lot of loss and death over the last year, and complicated ability to grieve. So if we can go to the next slide. So this is a little bit busy, but there was a Centers for Disease Control survey of mental health over the last, since the pandemic, and this was put out in June of last year. And what it showed of the general public, 40.9% of respondents reported at least one mental health or behavioral health condition at the time of the study. That's double what it typically is. Typically, a number like that would be 20%. So there's been a doubling just from the beginning of the pandemic till June, which is just really stunning. And of the respondents, the breakdown here is 40% reported one behavioral health condition, but certain subpopulations recorded numbers even higher. So in the 18 to 24-year-old group, the young adults, in school, Tracy's going to talk more about this, differentiating growing up. This is already a high-risk population before the pandemic for mental health conditions, but that number was 75%. 67% of unpaid caregivers of adults, 66% with less than a high school diploma, 54% for essential workers, 52% in the 25 to 44, the next age bracket, 52 Hispanic ethnicity. And then the breakdown of symptoms, which is on the right-hand side of this, is 31% had symptoms of anxiety and depression, 26% trauma or stressor-related symptoms, 13% started or increased their substance use. These numbers tend to be underreported substance use numbers, so I think that number is probably even higher. And then 11%, which is a hugely increased number, seriously considered suicide in the last 30 days before the survey. And that the breakdown of that, again, breaks down by category. So 26% in that same 18 to 24 year old, so 11% in the general population, 26% in the 18 to 24 group, 22% in essential workers, 19% Hispanic, 15% Black, and then 31% of unpaid caregivers for adults. And I think this has been a huge issue in the pandemic. Next slide. So that's the bad news in some ways. I think some of the good news has been about telehealth. This is the lemonade I feel like I'm making from the lemons of the pandemic over the last year has been around telehealth. So telehealth is can be defined in a lot of different ways, but we typically think of it as a video audio enabled visit with a provider. And these are numbers from Blue Cross. I'm going to show this slide and another slide, but we had about 200 telehealth claims a day in February of 2020. So I'm a practitioner. I had an office. I had telehealth availability. I would suggest it to patients and it'd be like, I'd rather come in and see you. So people weren't really using it. It was a ability I had that I rarely used. And a lot of providers were doing 0%. They weren't doing any telehealth. But by April, we had 40,000 claims a day, a huge spike upwards, and 60% of mental health, of our telehealth claims were for mental health care, which is huge. So our mental health visits are under 20% of our total visits, but the total for telehealth was 60%. And then in January of this year, it's dropped down to 27,000, but still way above baseline. I would say, I'm going to go to the next slide. And that will be my last slide. So there's two graphs here. The numbers that I was telling you about, this is a tracker for telehealth, national tracker. The top graph shows basically what I was showing you, that no one was doing telehealth and it spiked up to about 50+% of all care, and then it sort of dropped into the 20 or 30% realm in the latter part of the year. This is like a graph over the last year since the start of the pandemic. The graph on the bottom is psychiatry. These are physicians. So this isn't all provider types. This is a physician graph, but for psychiatrists, mental health specialists, you can see it's spiked higher than the 50%. It's about 70-something%, and it has continued to drift up and not gone down at all. That's been my experience of this, is that as a provider, my personal journey over the last year is that I had an emergency declaration of my own to my patients. I was doing telehealth, and then another declaration that, well, this is temporary, we're doing this to be safe. And it's like, well, this is kind of going on, so we're going to do a little bit more and we're going to beef up what we're doing. And then at the beginning of this year, in the year, my office closed and never reopened and won't reopen. The people running the office aren't going to reopen. I'm part-time in practice. And so this is the new normal now. And, at some point I'll probably go back to some office. But telehealth, I think, is here to stay. And there's a lot of my patients who are anxious to get back to seeing me in person. And there are many of them that the access and the availability for telehealth has, is like a whole new ball game for them. And I think both patients and providers weren't too interested in telehealth a year and 2 months ago. And now that's really changed. And I think that opens up a whole new way of helping people access mental health care that didn't exist a year ago. And I just don't think it's going to go back to where it was a year ago. It'll be different in another year. It won't be what it is now, but it'll be different. So with that, I'm going to transfer this to Tracy.
Thanks, Greg. I'm Tracy Mullare. I'm really happy to be here for this discussion today. I'm a child and adolescent psychiatrist. I work in the Physician Review Unit at Blue Cross Blue Shield, and clinically I also work in a telepsych company, so I can appreciate Greg's last slide and the real need to transform care delivery over the past year. And with that, over the past year, we saw some statistics on Greg's earlier slides about how the incidence of mental health needs has increased, really doubled during the pandemic. And the National Center for Health Statistics reports 46% of women and 47% of men are experiencing some symptoms of depression and anxiety. And when we break down this data a little bit, we see that disproportionately that caregivers are being affected. And the CDC reports 2 out of every 3 caregivers in the US are women. And women have needed to take on additional caretaking roles during COVID, often in addition to their ongoing professional roles. So caregivers, both men and women, at the start of the pandemic, abruptly often had to take on additional responsibilities, whether that was teaching or when the daycare centers closed, providing more childcare or attending to an elder or sick relative. And because of these needs, there, hand in hand with that is often a hesitancy on the part of the caretaker to really self-care, to reach out for medical assistance. This has always been true, and we've seen it's been heightened during the pandemic. And what we do know, obviously, it's anxiety is a normal response to a threat in our environment. That when we are feeling a threat, that fight or flight response kicks in and we're scanning our environment, and that is only normal. It takes a lot of brain power. It's exhausting. And a piece of that is protective. However, when it gets out of proportion to the threat in the environment or with ongoing fear and anxiety, it can really impact our ability to function both in a caregiving role, to perform to our best ability at work, to focus at school, or especially with children, you could see that impacting their ability to interact with their loved ones at home or what they're doing in terms of their play. And what we want to emphasize for folks as they're coping with the many stressors in the context of the pandemic is to identify your support system and reach out to it when you need to, whether that be your primary care physician. If you have a question about a child, reach out to the pediatrician. School counselors have been very involved with how difficult the schools open and closed picture has been for children and families. If someone had a therapist before the pandemic, it might be helpful to reach out to them. Also rely on your natural supports, whether that be a friend, a coworker, your group of people that you reach out to when you need some either comic relief or need an ear to talk to. And it's helpful to identify this team ahead of time so that when you need it, you can rely on it. Next slide. Thank you. And so we've established that having this fear and anxiety is normal and is exhausting, and how to cope with it is something that we're all struggling with. One piece of advice for all of us is, when we can, to take a moment to acknowledge how we're feeling and validate. It is okay not to be at your best, at your job, at parenting, whatever you're trying to do during this period of prolonged trauma that we're all going through. And it's important that we process these feelings before we can be at our best, before we can perform at our job, before we can be an effective parent. So it's important during any times of transition or question that we handle our own affect first. So schools are not opening or there's a quarantine. It's important that we take a moment and process how we're feeling before we approach our loved one, our children, about that. In terms of caregiving for children, it's a natural reflex for parents to want to problem solve, but it can be really helpful just to lend an ear and hear how they're feeling and acknowledge this is not normal. It's not okay that you can't play spring sports or whatever is going on, and to validate how they're feeling. In that way, the children are going to learn it's safe for them to approach you with feelings. They don't have to be worried about that, they're going to upset you or they can't handle it. So the message is, we're preparing to handle these situations together. And in that, my next bullet, making a coping plan for the unknown, highlights this, in that during a time of not high emotion, when you can get to that, it's helpful to think about what your coping skills are, what you do to relax, as well as help your children identify those types of coping skills, whether, an adolescent might like to listen to music, a younger child might have a particular game they like to play. Have sort of this coping ahead plan so that during a time of stress, they say, okay, I'm upset about this, I'm going to go do something to feel better. You will be doing so much for them in terms of teaching them a life skill on how to emotionally regulate themselves in times of stress. And this, again, such a hard skill to learn, such a hard skill to model, but this is really an opportunity to teach children and ourselves how to cope with very difficult things. Another tip is taking the emotional temperature of yourself. Through the pandemic, we talk about physical symptoms, taking our temperature. We need to know what our emotional temperature is, to know what we need, to know when we need a break, to know when we need to engage in self-care. Also, importantly, to be aware of if we need to take some time for ourselves. That's important because children are sponges within our homes and they pick up on parental anxiety. So for parents to take some time for themselves to handle their stress, not only are they going to be more effective in parenting, but they're modeling how to cope for their children. And so again, highlighting caregiver self-care is so important. The basics that we know are something we always need to remind ourselves, that sleep, hydration, nutrition are things that we cannot take for granted. They're going to keep us physically and emotionally healthy. Having other sort of tips in terms of limiting your dose of media, being informed without being overwhelmed, making sure children aren't in earshot of media is really important, as well as knowing, again, who are your social supports, what's your social network that you can rely on when you need help. These are all tips to manage anxiety. We can go to the next slide. So this slide is all about resiliency. So through this process, there have been some silver linings that families have been talking about with me, in that they're, no one would want to choose to go through this. However, children are resilient. They are learning to be more independent learners. They are learning how to cope and be more self-sufficient. A lot of families through this time have really fostered connections between themselves and have had improved communication. And that has been a really positive thing to have, as people have tried to be really creative, often through social media, making virtual visits, virtual play dates, really worked on prioritizing what's important and strengthening those relationships. And that type of resiliency is what helps us cope, but again, is building some really important skills for us and for our children. And next slide.
So we have 2 slides of resources. I don't know if you what you want to say. This we'll show this slide for a couple of minutes, and then the next one. This one really has the National Crisis Text Line and the National Suicide Prevention Lifeline. These are 2 resources if you have people who are really in crisis. There's stress that's normal and there's stress that's manageable. And then there are things that are either pre-existing psychiatric vulnerabilities or anxiety that's reached a level where you're worried about somebody. So we wanted to make sure to highlight resources that you would have if you're in a situation like that. And as we move into more of the conversation and question and answer section, so that you have this. And these slides, I think you have are being shared with your group, so you'll have them. Then there's the NAMI helpline and warmline.org. Those are what I would consider as like family and peer support networks. NAMI is a network mostly of families of people with serious mental illness, and warmline.org is peers, people with lived experience. And then for substance use disorders, SAMHSA has a national helpline, and then there's AA and Smart Recovery and other organizations like that, which are peer-led community organizations. They've also migrated to sort of a telehealth, it's not telehealth, but really, video-enabled meetings. And so, for substance use disorders, people have been isolated and drinking more, but there's also more opportunity to get to meetings without having to leave your home also, so that there were prior to the pandemic. And then there's another slide of resources. Maybe Tracy, you can talk about those.
Yes. So these are some more resources, more geared towards families, caregivers dealing with school, etc. The first one is through the American Academy of Child and Adolescent Psychiatry. It's a really great resource. It's a whole resource library about COVID-19 regarding a lot of helpful advice about resources as well as supporting our families. The next one is a parent guide to remote learning, which there's been so much information on the internet about support for school closures, and it's stunning that to this date there's still some schools that are just opening fully, so that can be a helpful resource. As the second one too, it's about sending children back to school and navigating emotions and preparedness for that. And the last one is some special resources for special education, which has been, I know, a challenge for many families that if you're remote learning and needing some assistance, how to navigate that to make sure that supports are in place and that you're advocating for those special needs.
So I don't know how you want to do Q&A. We can chat a little, Tracy and I, while we're waiting for that. But I was sort of struck by the fight or flight, or the fight, flight, or freeze response, which is kind of your body's natural protection. And it's particularly tough in a time like a pandemic, because it's not the tiger charging you where you run away, or it's obvious there. The fear is real. It's the disease is out there. It's the mortality rate's been high, but it's not something you can see. And over the course of the year, it's been very complicated how it's kind of unfolded in our country. And so I think that you know, how you manage that and manage the stress of that, knowing that your body is, you know, that's a natural response, and lots of things can increase that stress level and decrease it. And so you mentioned some of those things, like the media diet, and you know, before this meeting, we had some intense work meetings prior. It's like, okay, you know, I need 15 minutes to like stop, because I'm wound up by the prior meeting before I come to this meeting, because otherwise I'll be more anxious. And then I'm performing, and so that's going to make me anxious too, because I'm giving a talk in front of Zoom meeting, you know, and a new group. And so, you know, you're trying to mitigate that anxiety and be aware of the things that tend to drive it up, and that tend to drive it down. And I think you know, everyone has their different mix, but I think you mentioned some of the things about making sure you have a good night's sleep, and, you know, starting your day, and, you know, acknowledging your feelings, and, you know, kind of the things that are making it better and worse. And I think exercise is another thing.
Yes.
I think that, you know, watching your diet and watching your alcohol or other, you know, substance use, but alcohol is a really common one. People will sometimes drink to help them sleep, but it actually worsens their sleep, and then they feel worse, and it can become a spiral. So I think one of the things that people can do is think about that kind of self-regulation and sort of day-to-day sort of wellness or sleep hygiene kind of activities. I don't know what else you'd add to that, Tracy. But
Yeah, no, I think it's so important. And I think sort of that mindset of reminding ourselves that we do have this heightened level of anxiety that's pervasive during this prolonged period of COVID, and our needs to sort of be more careful, to watch out for our kids, our families, ourselves. And I mean, there's some days that I have to remind myself, like, why am I so exhausted? This was the weekend day, but you're constantly, your mind is so busy doing this. And it's so important, you know, to take those moments, even if it's a 5-minute deep breathing sort of session, a little walk. There's so much on the internet. There's some great apps for relaxation, mindfulness that really make a difference. So I think I would agree. And that need for structure, you know, what makes us well keeps us well, in terms of, you know, getting up on time and eating consistently and having some exercise, which is really hard to be out and about, but just being mindful of those little things that make a big impact. And the overarching theme is to be patient with ourselves, because this is really hard. It takes a toll on how you're feeling. So that's okay. And I think having that for myself, lowering the bar a little bit. Maybe I'm not 100% going to get all my work tasks done today, or I'm not winning any mom awards today, but we're getting through the day safely. And, you know, we're enjoying what we can. And those moments are really important. I think one of the slides I talked about the new normal, which can change on a weekly basis, depends on what's happening with school, with work, with openings and restrictions, but sort of salvaging, you know, this is our time together as a family. This is the structure of our day that we are going to try to continue, and have that be the new normal that, you know, again, is going to evolve, and we just have to be patient and try to take care of ourselves along the way, and reach out when it's a tough day.
well, you're being a self-forgiving, right? You know, managing
Yes.
your
Oh my
expectations.
gosh.
Yeah, I've heard people like, oh, I learned Spanish, and you know, people tell these stories, and I'm like, what? You know, and I'm on a day off. I just want to not be in this room one day, right? You know, so like I think, oh, I should go do something, and I'm like, but I have to be in that room again, you know, another
Right.
day. So, you know, it's I think kind of querying your self expectations and managing them, and being forgiving and kind to yourself a little bit about what's really doable. I know for my patients that I see, there's been an ebb and flow over the last year, so I have an existing practice of patients who I knew prior. So I've taken them through other stressors and then through this pandemic, and it's been interesting. Some of them really struggled at the beginning. It was so new. Others were like, oh, I know how to manage anxiety. And so they were great in the beginning. And then there was a reversal. So some of them like learned skills they didn't have, and then they've done better over time. And then others were like, well, now I'm struggling, but why am I struggling? Why am I struggling? It's like, well, the pandemic is still going on. It's like, oh yeah, right. It's sort of, so it affects people differently, and to understand, where you are. And that's just the arc of the pandemic, let alone anything else in an individual's life, and understanding, what are your skills, and even people who have skills, sometimes they need a little bit of a booster, and really re-looking and saying, okay, I can't just automatically do this. I need to pay attention a little bit more and kind of boost what I'm doing, and maybe learn a new skill because it's getting ahead of me. And so it's complicated.
It's complicated. And I think that fluctuation is such an important point, because I've talked to some folks who sort of, we're hearing the light at the end of the tunnel in one respect. There's a vaccine, people are getting some help. And then there's also been the 1-year anniversary that we've been doing this, and that kind of reconciling with those two things. Or I have a little hope now, my parents have been vaccinated and things are getting better. And now people are feeling, having time to process a little bit more. Like that grief, I think, happens in different stages. And I think being patient with that process, and understanding that that's to be expected. And those are the times where we need to reach out for supports, or do a little bit more self-care.
Nancy, I think you're on mute.
Hi, sorry.
That's okay.
I clicked on something and didn't know what I did. You'd think by now we all knew how to use Zoom.
No, being patient with technology. I should have added that to the list. We all have those issues.
No, thank you. And thank you so much for everything that you said. I think just hearing it reinforced sometimes is just very helpful for me. I really appreciated what you said about resiliency. Again, being a year in, I have two elementary age school children, and getting into now, like you said, a year of now being mostly remote learning. When we kind of started this, it was like, I don't know how we're going to get through this. And now it's more, I've seen, wow, my 4th grader knows how to use a computer almost as better, if not as better as than I can. And he's like, he's got the control out the leads and down, and he could hardly type like a year ago. So it's been great. It's been great and stressful at the same time to see those skills kind of increase and improve. So it's nice to hear that. One of my questions that I had, if I can help with starting the Q&A, is about the kids, and kind of keeping an eye on them when it comes to their anxiety and their stresses. My 2 kids are completely opposite from each other. One of them will tell me exactly how he feels. The other one is much quieter, and we kind of have to probe him to get answers out of him. And even then, sometimes it's hard. So what are some things to look out for when it comes to anxiety? Particularly as we kind of open up more. I mean, I think we kind of know, as we've been closed, but as we open, like what to keep an eye out for. And what are some ways, like some questions or ways to kind of help guide those kind of conversations?
Yeah, it's such a good question. I think it's something, those issues are things all of us as parents have been struggling with. And I think your point's well taken too, that kids are different in terms of their ability to verbalize how they're feeling. I mean, it's always going to be different developmentally depending on age. But the fact that you're sort of setting the stage and they're feeling they can communicate with you as they can is amazing. I think it's helpful for parents to check in once in a while and just say, how are you doing with this, and leave it open. If they have nothing to say, that's fine, and say, okay, but the point is, I'm going to come back and check on you again about this down the road, just so they know it's there and they know that that's a space that they can use. And if they have something that's upsetting, you know, you want to hear it. Like, you're not going to say, nope, we're going to fix it, and, you know, not going to hear them out. They're going to feel it's safe for them, and that you can handle any emotion that you bring to you. So the fact that you're setting that stage is wonderful. Things to look out for in terms of if children are having trouble coping would be really a change in behavior. So kids that are really outgoing, that all of a sudden are withdrawing. They're not wanting to spend time even with family members. They're not engaging in their usual activities, not interested in play, a lot of tearfulness, anxiety that really impacts function. Like, I mean, everyone has you know, some trepidation about navigating the world right now, but a child that maybe doesn't want to go for a walk, is, I'm hearing kids that are afraid to leave the house, that warrants maybe call the pediatrician or reach out for some guidance. As well as, there is a level of regression that's normal during a period of stress. For kids to be a little bit more clingy, that's really normal. For kids to act a little bit more developmentally immature for a time, that's normal. But severe regression, severe fear, like won't leave a parent's side, recurrence of bedwetting, for example, those are all reasons to reach out to a pediatrician, as well as if they're expressing, you know, extreme distress, feeling unsafe, feeling, God forbid, they want to hurt themselves, anything that's concerning, then that's time to reach out to either a mental health resource or the pediatrician for guidance.
Yeah, that's all great advice. I mean, all I would add is, you know, modeling how you're feeling too is another technique. You know, to just share your own, you know, this is a good or a bad day with the pandemic or whatever's going on, you know, how is it for you, or things that you observe, rather than, you know, it's a way to sort of draw them out as opposed to probe them for question, you know, for information, is another idea. And the only other thing I wanted to put on is the idea of whatever screen time is or was, it's different now, right? And so I think thinking about that, you know, as far as what you're doing with the screen, right? Are you, you know, on social media? Are you having a conversation? Is it the same thing? You know, I think that whole, I don't know what the answer is for that. I bring it up more as it's a question to sort of think about, you know, how are your kids connecting and who are they connecting with? And when you can't do as much in person because of the pandemic, you know, how are they using the technology? We've all had to sort of adjust. I mean, I have a clinical practice that's 100% telehealth, and that was not what it was a year ago, right? You know, I mean, so I've had to learn how to be a telehealth practitioner. That's just one thing. That's just a piece of my professional life, but, you know, everything else, all other interactions. And so I think it's the same for kids, and they may not be able to articulate it. So I think to even articulate it as a parent that you don't know the answers to that, you're learning, you're adapting, and, you know, but, you know, whatever your impression is of that.
Great, thank you so much. Do we have any other questions from our members?
I have a question I'd like to ask. I'm gonna do that. Sorry, my computer is jumping off a lot. So you talked about how everyone is stressed out right now. I'm sorry, my computer's jumping around. I'm trying to get where I wrote my question down and it's not letting me. How can I tell like what's normal stress and what's like when I should try to find someone to talk to? Like, how can I tell if I'm more than kind of the normal COVID elevated state?
We're both about to start at the same. I mean, I would start with safety and functioning. So those are two very high bars. If you're feeling unsafe, it's always time to reach out. And if you're functioning, you know, we said be forgiving, you're going to be less functional. But if you're really starting to not fulfill roles that you need to, that's definitely those are too high bars, or definite times where if you're starting to, lose interest in things, lose pleasure, not sleep, alcohol level going up, those types of things, sort of things beyond just the anxiety, those are very worrisome. And then further down, I would say if you're starting to wonder if it's worth reaching out to somebody, it may be worth reaching out to somebody to talk. It doesn't mean you need treatment. It doesn't mean, but sometimes having a professional or somebody who's outside of yourself to talk through an issue can be useful. And there's lots of ways to go about that. What were you going to say, Tracy?
Yeah, no, I would agree. If for severely impacted functioning, your inability to do the things you want to do, experiencing panic, of course, as Greg was saying, any issues about safety, then reach out. And as Greg said, if you're thinking about if I should or not, reach out, because it is so difficult when anxiety is a normal response. But it's so important to sort of have someone to talk that through if it's really affecting your ability to function.
Okay, and a bit of a follow-up. What if I'm from the outside and I'm seeing that someone I love is starting to seem a little different, like seem really down? How can I help them? What should I try to do for that?
It's hard. It's hard to stand by and watch that, right? So one way I would start is to share your own concerns and your own worries. I don't know what you would suggest. You want the best for them, what you want, what you see, what you miss about them, that, depending on what the change is that you're seeing, that can be one place to sort of open the door. There's so many, what's the basis of the relationship? What kind of relationship? Is it a parent-child relationship, a friendship, a family relationship? So there's a lot of factors, but that would be one place of, you're sharing what your observations are and what your, concerns or wishes for that person are. Tracy, what would you say?
Yeah, I would agree. Again, it depends on the relationship, the nature of the relationship, but I think sharing what you've noticed and your concern and why you're concerned is always a good idea. If it's someone that, someone that's closer to them, and you don't think it's sort of a violation of that person's trust, you can, just say, oh, I was just a little concerned about them. Maybe you should check in with them. Just encourage the person to reach out to their supports as well.
And I think if you can draw people out, tell me more, how can I help? What do I need to know? That's another way, again, sort of drawing them out, and then offering to help. And that can be complicated too, but.
Yeah, I think that offer and outreach can't be sort of minimized in a time where people are feeling more isolated. So I think just their inquiry and your expression of concern is going to go a long way and might help them reach out or talk more about it.
And even for somebody where there's a safety concern, this isn't really what the question is asking, but I'll put it out there. So there's, I think there's a fear if somebody is suicidal that if you ask about it, that will make it worse. And it's exactly the opposite. It's one of those great myths of suicide that asking puts the thought into somebody's mind. It can be actually a relief if somebody's struggling with safety, for somebody to ask and say they love them and they care for them and they want to help and they want to know more. Tell me more about that. It's very hard to do that. It can be scary. But in doing that, you actually can save a life by reaching out and by allowing that person not to be alone with a very terrifying mood state and feeling that their life is hopeless and not worth going on. So it's worth putting out there. Always best to ask and ask to know more. And that's why we put suicide helpline and some of the things on there, because you then need to go further with it, right? If somebody who's a family or a friend who worries and then reveals that, you may need more. you know, you're a friend, you're a family member. You can't hold it alone, but by being part of that, you can really sort of save that person. It's very much in real time, because people with thoughts of suicide, it really ebbs and flows, so giving them a space where they know they're not alone with is very important.
Great. Thank you so much, both of you. I just want to bring to your attention, there was a message in the post that particularly in regards to just thanking you for your resources about going back to school, particularly when it comes to kids with high needs. It's been a challenging working with high needs students that have not been able to physically be in school for the entire year, and trying to work full time and manage the rest of the home. And I can agree with that one too. I kind of in the same position, and it has been stressful, and I really do appreciate the resources that you just shared as well. I will be looking into those. My question that I have, another question is, you know, I think we've learned a lot through all of this when it comes to many things, as using Zoom and things like that. What's some of the things that we've learned through the pandemic that you hope that we continue to use, you know, as we, you know, when we get out of this, whenever that comes, that there like some tools that we've had that maybe have been added to your toolbox?
So in terms of what we've learned, I would say the thing that I keep hearing about is how people have reprioritized what's important to them and sort of reinforce those connections, and needed to really make extra efforts through social distancing to maintain those connections. So I think those skills of prioritizing what's important and maintaining support and communication with our family, our friends, people that are important to us, has been something that's been important to me, and I've heard from a lot of people. And in terms of skills, I mean, I think the silver lining of resiliency in kids, that when they're learning how to cope, that these skills are lifelong. They're really hard skills to learn, right? How to get through something stressful, and what can we do to help with that? And often, you know, what we know from the research of disasters, that children's anxiety is directly related to how their parents handle stress. So it's really been a golden opportunity for parents to model how to handle stress, even if that said, I don't know the answer to this. And we're going to sit with that unknown, and we're going to cope with it. And how we're going to cope with it is, you know, we're going to reach out, we're going to get information. We know what keeps us safe right now. And in the meantime, there are things we can do together to feel better, or things you can do yourself to feel better. And kids gain confidence that way, that they have a sense of what they can do, whether it's wear a mask, wash your hands, watch your distance, or when I'm really anxious, I have this special teddy, or I listen to this music or whatnot. So they have these things that are within their power, and that's been a real silver lining that has helped kids feel a sense of control and will help them manage anxiety moving forward.
That's great, Tracy. I think what I would put out there is the telehealth, this year of telehealth, I can see a vision of a kind of a different way that's not about telehealth or not telehealth, and much more a vision of how do we get the right help to the right person at the right time with the right modality, not like, well, we believe in telehealth or we don't, or we do it or we don't. This sort of black and white option. And, you know, we have a provider group who's starting to think about, when does somebody need to be inpatient? When do they need to be seen in person? When does their family member need to be seen in person? When can their family member be seen via telehealth? When can they do a telephone call? When can they do a brief check-in? And there's like a continuum of care, from in-person, at a facility, in an office, video connection, telephone call, text message, that I don't think was conceivable a year ago. And I'm not sure we're there quite yet either, but people are conceiving of it, and I could see it beginning to happen. That's not so black and white. And I think that for mental health, how do you reach someone easily and quickly is not where we are in the mental health field right now is very decentralized. And so a person, providers are busy and trying to do their best to take care of their patients. That's what I'm doing. But as far as a person who needs something now, how do they get somebody quick and easy at the right level for them in the moment? I could see something happening with a combination of in-person and telehealth care that was more fluid, that could actually work to help with that. That's to me really exciting, because a year ago I would have been very pessimistic about anything. It was a slow plodding change, and the fact that psychiatry and other mental health practitioners are using this a year later, partly is because we're still in the state of emergency, but part of it is I think they're learning how to actually use it, and people are learning how to do it. And I think there's a huge opportunity on the horizon to try to help people in a better way, like at the time they really need it. So they're not calling 50 doctors trying to find someone who has an open slot, which is where things are now. So.
Great, thank you. Are there any other questions? Seeing none. I just want to again thank you, Dr. Harris, Dr. Mullare, for joining us today. Thank you to Blue Cross for providing this opportunity for us to speak to both of you. And again, thank you so much. This was very informative. Very much appreciate your time.
My
Thank
pleasure. Thanks for
Thanks.
having us.
Thank
Have a
you.
nice day.
Stay
Have a nice
well.
You
weekend.
too. Bye.
Bye.